so much for taking time to sit down with us today and share more about your important and pivotal paper titled Anxiety and Depression in Patients with Histiocytic Neoplasms and Their Associated Clinical Features. I understand this was published recently in Blood Advances and was a collaborative effort, which once again, as you are no stranger to in all your work, takes into consideration the patient perspective and patient voice. So we're eternally grateful for your continued focus on patient-reported outcomes. And to quote part of the paper, anxiety and depression are common in many cancers, but have not been systematically studied in patients with histiocytic neoplasms. So this study sought to estimate rates of anxiety and depression and identify clinical features and patient-reported outcomes, or PROs, that are associated with anxiety and depression in patients with histio. So I know we know you very well, but for those who do not know you, would you mind giving a brief introduction of yourself? And then can you share the background work or catalyst that inspired this manuscript?
Thank you for having me for this conversation to discuss this project, which, as you mentioned, was a collaborative effort between our group, other investigators, and of course, the association and the ECD Global Alliance. So this is a study that's based in the registry that's at Memorial Sloan Kettering. And in that study, we follow our patients over time in the course of their routine clinical care, and periodically, which is to say every 6 to 12 months, the patients complete a battery of surveys or patient-reported outcomes where they describe physical symptoms, cognitive, emotional symptoms, experiences like financial burden, their employment status, their overall quality of life, and their mood, specifically anxiety and depression. And this particular study stemmed from our observation in the care of patients that struggles with worry, anxiety, depression, sadness are a really common problem for our patients. So what we decided to do was look at the registry and see what's the frequency of these types of struggles in these patients. And so we studied patients with ECD, Erdheim-Chester disease, LCH, Langerhans cell histiocytosis, and Rosai-Dorfman disease, RDD. And we looked at how common anxiety and depression are in general, moderate to severe anxiety and depression, and then we looked to see whether there's any factors for the patient that are associated with higher frequency of anxiety or depression, and whether there's any other factors related to their trajectory or their past or their treatment more associated with anxiety or depression. In this study, we looked at mood in 215 patients, and what we found was that one in three reported either anxiety or depression, which is, of course, a really, really high number. 34% of the group reported anxiety, met criteria for anxiety by this particular survey, and 28% met criteria for depression. In terms of some of the factors that made it more likely for someone to have these struggles, for anxiety, what we found is that people who reported a greater amount of financial burden had a higher frequency of anxiety. That's probably not that surprising. And then we have a dedicated patient-reported outcome survey about patients' experience of their own sort of cognitive health and cognitive function. It's not the same as formal memory and concentration testing, but it's more the person's appraisal of their own cognitive function. And individuals who experience themselves as having struggles with thinking and memory were more likely to have anxiety. And then people who had greater pain severity had more anxiety, and also people who had more fatigue severity had more anxiety. In terms of depression, the findings were a bit different in that we saw that ECD diagnosis in particular was more associated with depression. Not that it was absent in the other diagnoses, but that it was more common. Also, people who had neurologic involvement of their disease were more likely to have depression. Interestingly, people who were treated with conventional treatments, which is to say chemotherapy or immune suppression, more frequently had depression. Also, people who were retired or unemployed. And then people who had had a longer undiagnosed illness, meaning that their time from first symptom to their histio-diagnosis, if that was longer, they were more likely to have depression. And then similar to anxiety, having greater financial burden, having more severe fatigue and more severe pain. Those were all things that were associated with higher frequency of depression.
The findings are really validating, I feel, to what a large number of people with histiocytosis likely experience, and not knowing if that's something that others are feeling, but being able to really see it on this scope, it really helps to show that this is an impactful in a in a hard way, to go through this journey. And I wonder if, and can you speak to if there's any insight into whether or not the anxiety and depression could also be related to the disease itself, or is this due to some of these more, we'll call them external factors and situations?
I would say that we didn't answer that question. And if I had to guess, I would say that it's many, many, many factors. I think that and some of these findings are not unique to histiocytosis. Some of these have been found in other cancers, but I think that these struggles are particularly common for histiocytosis patients. Um, whether it's financial burden because of having to travel for providers and multiple physicians, and having just the cumulative psychological effect of unmanaged symptoms or undiagnosed illness. So I think that if I had to guess, I think that there are coping, sort of cumulative psychological type effects. And I think that there is some degree of a biologic effect also, whether it's inflammation in the body, and the fact that chronic inflammation can be bad for mood. I mean, one sort of limited comparison is, if someone is ill, like they have the flu or they have a virus and their body's very inflamed, there's certainly sort of a lowering of mood, in that setting. And so there's some idea out there that the inflammation in the body, also itself can be associated with worry and sadness. And I certainly have some patients that none of the other factors have been changed, but treating the disease has led to an improvement in people's worry or sadness. So I think that there's many factors, and it's an opportunity to try and address it, as many of them as we can.
Absolutely. So does that speak to some of the impact that this work will have in future studies, or opportunities to support patients in different ways? And where do you see this research leading us?
I think so. I mean, I think that probably the most important implication for practice, whether it's for me or for my colleagues and friends who treat other histio patients, is to ask these questions, and to find out whether worry and sadness are really present in a way that can be a clinical problem, and in a way that can be addressed in various kinds of ways, depending on what's the best fit for the patient, whether it's social support or a counseling type intervention or medications or what have you. There's no one size fits all for the management, but I think that awareness on the level of each patient at least provides the opportunity to help people.
Absolutely. I think that's really important. And also for people to recognize that it's okay to talk about these feelings that they're having and that they're very valid, and to be able to find someone safe that they can bring that up to and find the support that they need, even if your doctor isn't aware and maybe isn't asking those questions. Was there anything else in the study or anything else that you had put into the manuscript that really stood out to you, or you think is an important point of awareness for other providers to be thinking about?
I just think that it's a reminder that a lot of these struggles are, on the one hand, not completely unique to histiocytosis, but are very much so amplified. And a lot of our previous patient-reported outcomes type studies have shown, the frequency of various symptoms, pain and fatigue that are, higher in these patients than in many other cancers, and that there's a lot for these patients to be struggling with.
Absolutely, and that comes with also being rare. So tapping into resources, through the institution or through advocacy groups like the ECD Global Alliance or the Histio Association, because with the cancer classification for histiocytic neoplasms, there are programs available that you can tap into. However, they're much more readily accessible with some of the more common cancers, I would think. So I'm also recognizing some of the opportunities that could exist. Um, are there any other patient-reported outcomes that you envision exploring in the future that stem from this publication and these questions?
I think that this was pretty much an observational study of anxiety and depression in relation to all these other factors, sort of looking back over a year of data. I think that um, in the future, these could be timed and studied in a way that we can sort of more rigorously evaluate whether certain types of interventions help with this better than others do.
Wonderful. Is there anything else that we didn't talk about, or anything related or unrelated you'd like to share with the Histio community?
No, I just want to echo a point that you said, which is that some people may they may be reticent to talk about this, and I think there may also be a mentality of it's understandable that they're worried. It's understandable if you went through this, wouldn't you be also? And while that may be true, it doesn't mean that it can't be helped. So it is something that we on the healthcare team and certainly want to try to help if we know. And again, there's many different ways to help with this, whether it's social or complementary alternative type approaches or one-on-one counseling. There's many different ways, but it's something to take on.
Okay. Well, thank you so much for first and foremost exploring this really important perspective, and also for all your wisdom on how to navigate this from both the patient and the provider side. So we appreciate you so much, and thank you for taking time to dive into this. We'll include the link to the article below, and if you have any other questions, reach out.
Great. You're welcome. Thanks so much.